Okay, we're going to review some findings here on the skull from the inferior view. We'll start with the large foramen magnum, the large opening at the base of the skull, and we'll show you the jugular foramen, these M-shaped areas on both sides, large openings for the jugular foramen, for the jugular vein. The hypoglossal canals are located just inside foramen magnum on the lateral walls. We'll get another view of that from the other side, but the hypoglossal canal are located right inside there. We'll move up to the anterior portion here and look at part of the sphenoid bone. Here we have the pterygoid plates. We have the medial pterygoid plates, which are the inside ones toward the midline. Then the lateral pterygoid plates right here on the outside. We have the pterygoid fossa located in the middle of the two plates, this depressed area about the size of your pinky, and the hamulus located at the apex of the medial plates. Pointy projection. We go back down and start looking at some of the passageways. We have foramen ovale located on both sides because it's pretty oval or egg-like in shape. Immediately behind ovale we have spinosum, which is much smaller, tiny opening. We have the carotid canal right here for the carotid artery to pass through, pretty centrally located just above the foramen magnum. Then we have the mandibular fossa, or the glenoid fossa. It's a portion of the temporomandibular joint. It's where the head of the mandibular condyle sits from the mandible. Then we have a couple large processes that stick out. We have the styloid process right here. You can see it on the other side as well. Sharp, spiny-like thing. Styloid process. Then we have the mastoid process, which is much larger but not nearly as sharp. Again, located on both sides. Mastoid process. And then we're going to go back up to the anterior area to the palate, and we'll look at the palatine bones. We have two bones here that are considered the palatine processes of the maxilla, and behind those we have the actual palatine bones, two much smaller bones that form the hard palate. And this is the incisive canal at the anterior region where the rugae of the mouth pass over the hard palate.